Welcome to Anatomy and Physiology, Chapter 5, the Integumentary System, video number 7. In the last video, we talked about the two regions of the dermis. We're going to look at some different features of the dermis with cleavage lines, stretch marks, and epidermal ridges, and look at subcutaneous tissue in this video. So cleavage lines, even though we said the reticular layer is dense irregular tissue, there is a little bit of orientation of the bundles of collagen fibers. So these are called cleavage lines. So they are the orientation of fiber bundles in one direction in the dermis. And these are sometimes called Langer lines. And I'm going to switch over to a screen here of this, if I can figure out how to do this. Well, there's a picture in your Schoology folder of the Langer lines, and those are different lines of fiber directions. And surgeons use these lines in order to make cuts in the body a lot of the times to help minimize scarring. So they will follow a general outline because if you cut across these lines, you can get puckering of the scar. Especially in plastic surgery, they use these lines. So it helps minimize any scarring if you do have to cut. So you can look at this picture on your own. It is a drawing, it is not an actual picture. The second thing are stretch marks. And stretch marks are something that can happen to either people who are overweight, but more likely they are for ladies who become pregnant. So this is a rupture of the dermis due to overstretching. So remember that the dermis has some give, but if the stretching of it happens too quickly, it can start to tear and rupture. And it would end up being a tear of the dermis, which we know from our tissue repair in last chapter can result in fibrosis or scar tissue being formed. So it looks a little bit different. People gain weight a lot more gradually than a woman becomes pregnant. So it's not likely that you'll have stretch marks, but the common cause of them is pregnancy. And the last thing, epidermal ridges. It's a fancy name for fingerprints or toe prints. And yes, your toes do have prints just like your fingers do. These are only found in thick skin. So they are found on your fingers, your palm, your soles, and your toes. And these are downward projections of epidermis into the dermis between each papilla. And again, increase surface area, which increases grip. So this allows us to hold on to things a little bit better. So it helps increase our surface area. These develop in the womb, and they are unique to each individual. So we tend to use fingerprints as a identification device for a lot of things. So you might have to put your thumb or your finger on your phone. Maybe it's a biometric ID. And there's databases of fingerprints, so they can match those in any forensic data. So those are pretty interesting things. And I'll put up a video, or not a video, but a picture of the different types of fingerprints, and then you can look at yours and determine what types you have on each of your fingers and your thumbs. So the last thing that we'll talk about in this video is subcutaneous tissue. This also is called hypodermis. It's really not part of the skin. It's more underneath the skin, but it's usually talked about during a discussion of skin. So this hypodermis or subcutaneous tissue, we have a lot of adipose tissue. So this is mainly adipose tissue, which is connective, except in two parts or two places. So adipose tissue is not underneath the eyelids or in males the penis. So there's no fat underneath the skin layer in both of these. It would make them look a lot different than they look if you think about it for enough time. And that's all we'll say about that. But the purpose of this is to help. So this helps attach dermis to underlying muscle and bone. So this is kind of a go-between. So it's mainly adipose. We're going to have a little bit of areolar in there too. And about half of your body fat is stored here. That's not for somebody that is obese or grossly overweight. They are going to have a lot more fat stored in certain areas. But for a person of normal body weight, this is distributed all over your body except for eyelids, or if you're a guy, on your penis. So this provides insulation, padding, and energy storage. So you've probably seen pictures of people that have been starving or are anorexic. Their skin is they look like skin and bones. This helps fill in some of those little nooks and crannies in our body and gives our skin a smooth appearance.